Hello guys, today we discuss about immediate care of newborn. The following care needs to be given newborn at a birth in the labor room. First one, deliver the baby on warm and clean towel. Second, establish and maintain patent airway. Third, ensure warm. Fourth, assessment and documentation of baby's condition. Fifth, care of eyes. Sixth, clamp and cut the cord. Seventh, care of skin. Eighth, administration of vitamin K. Ninth, identification of baby. 10th, transfer to the baby according to the level of care required. Next, we discuss one by one. First one, deliver the baby on warm and clean and dry towel. Soon after the birth of the baby, can deliver the baby on warm, clean, dry towel. Next one, establish and maintain patent airway. The neonate cries spontaneously at a birth. During crying, the secretion of the mouth and nose are suctioned to a clear airway of mucus and amniotic fluid. If the baby is not crying, gentle tactile stimulation should be provided. If the child does not cry, after the stimulation, CPR should be given. Gentle suction should be done to prevent bradycardia, laryngospasm, and cardiac arrhythmia from vaginal stimulation. Next one, ensure warmth. The heat regulated mechanism in the neonate is immature. The neonate loses their heat due to the evaporation, radiation, conduction, and convection. To prevent the heat loss from the baby, can follow the some steps. They are: the delivery room should be warm with temperature 25 degrees Celsius to 28 degrees Celsius. Dry the infant soon after the birth by using warm towel. Place the baby under radiant warmer or mother chest in the skin to skin contact with her. Next step is assessment and documentation of infant condition. Soon after the birth, 1 minute and 5 minute APCA scoring is done. While drying the baby, head to toe assessment should be done to find out any abnormality in the newborn. Next one, care of eyes. The eyes of the neonate are cleaned soon after the head is delivered by using sterile cotton swab is dipped in sterile water. The eyes are cleaned from inner canthus to outer canthus with a separate swab for each eyes. Next, care of cord. The umbilical cord is clamped when the cord pulsation stop. This provide infant with extra blood from the placenta. The cord is clamped with two clamps and cut between the clamps, leaving about 1 or 5 cm from the baby abdomen. The stump is left without any dressing. It is inspected repeatedly for a bleeding for up to 24 hours. It is observed routinely if any redness, inflammation, or any discharge till it fall off. Next, care of skin. The neonatal skin is very delicate, so gently wipe off the blood, mucus, secretion. No attempt should be made to rub off it. It is a protective wernicke caseosa. The areas which fold such as neck, axilla, groin region and joint which require special attention. The practice of giving the bath to the baby at the time of the birth increases the risk of hypothermia. So bathing should be postponed for 48 to 72 hours or more after the birth depending on the baby's condition. Next, administration of vitamin K. For a few days after the birth, the newborn is unable to synthesize vitamin K that is needed for blood clotting. So, there is a potential problem of abnormal bleeding. Therefore, 1 mg vitamin K is administered to the baby by IM. Next, identification of the baby. Before the baby is transferred from the labor room, an identification band is placed on the baby wrist. Specify their mother name, registration number, date and time of the birth and baby of the sex. Also, foot impression of the baby is taken for the baby's identification. It is important to provide the mother an opportunity to see and touch the baby and note the sex before transferring the baby to the nursery. Next, transfer. All the normal babies are transferred to the mother and nurse along with her postnatal area. This is called rooming in. Breastfeeding should be started within a half an hour after the birth, and sick or at a risk neonate should be transferred to the neonatal intensive care unit depending on the baby's condition. Next one, prevention of infection. All personnel coming into contact with the baby should be free from the infection. Washing the hand should be practiced strictly, and strict aseptic precaution should be taken while handling the baby. The personal hygiene of the mother and baby should be maintained. Strict number of visitor attenders attending the baby. Next, care of bladder and bowel. If the neonate failed to pass a urine and stool within 24 hours after the birth, it should be notified to the physician. The urine output is about 200 to 300 ml by the end of first week of life. Neonate weighed about 15 to 20 times in a day. Diapers should be changed as soon as wet. The neonate also passes a stool frequently, so diaper area should be cleaned with a mild soap and water. The baby should be kept clean and dry. Next, maintenance of personal hygiene. The personal hygiene of the both baby and the mother should be maintained to prevent the infection. The baby should be given a sponge bath daily in a summer and every alternate day in a winter. Lukewarm water and mild baby soap should be used for giving the baby bath. Special attention for the paid to the skin creases at axilla, neck, groin, and thighs. Next, prenatal teaching and follow up. The period when the mother is in postnatal ward can be utilized for teaching the mother about all aspects of baby care. Parents are observe the child daily behavior related to feeding, sleep, activity, cry, elimination, etc. Parents need to be told about holding the baby, baby bath, eye care, cord care, feeding and nutritional supplement, immunization, prevention of infection, and follow up care. The parent should be educated about danger signs of the baby, which, if present, require immediate hospitalization. Thank you for watching, guys.